am Dr. Christina Smillie. I started the first private practice medical clinic in breastfeeding medicine in the United States a little over 25 years ago. And I've learned a lot from the babies that I've been helping, babies and parents. So, and one of the things that I developed was this idea of that babies are already hardwired to breastfeed. And people often ask me how to apply the so-called baby-led breastfeeding to what's called breast distress, or some people call breast refusal. They see that some babies will get riled up just to be near the breast, and others seem to calm at first, put into a skin-on-skin position, and then the babies, as they move towards the breast, will suddenly get frantic. And so it seems impossible to apply this idea of baby-led breastfeeding to the baby who already has a lot of breast distress. Let's look at, here's a quick video showing a baby under those circumstances, where he's actually even trying. If you see, he's trying to move towards the breast, but he's getting too frantic, and so he's too disorganized to do that. So there's a lot of language that is used to describe the situation. It's often termed breast refusal because that's what it may look like as a baby gets upset near the breast. Mothers can be very discouraged. This is the kind of language they use, from he doesn't know how to breastfeed, or he just plays with it, or describing how upset the baby gets, that he prefers the bottle. And then the mom has strong emotional statements. He hates the breast, or even he doesn't like me. Really distressing for a mother. So what I want to express is that this is a new problem. It's created in the past few decades by attempts to force babies to the breast. If you look to the older literature on breastfeeding, they see all the problems that we still see now, and they're all described in those older resources, except for one. No one in these older resources talks about breast refusal. Oh yes, there's a few older babies who had already been breastfeeding just fine for 8 or 10 months who might suddenly go on what's called a nursing strike, which, by the way, is also typically caused by a sudden event at the breast that scared the older infant. But the older literature never mentions newborns refusing the breast. So let's talk about the language itself that now gets used around this issue. By analogy, let's think about a 1-year-old who is not yet walking. When it comes to walking, we all still accept that toddlers learn how to do this on their own. We don't have to force it. But imagine if we did. What would happen if we didn't trust toddlers to figure out how to walk on their own? We'd be using the same language, the reluctant walker, crawling confusion, walking distress, and the baby who refuses to walk. What would create that situation? By not trusting the toddler, imagine if one parent is holding the baby upright and the other parent is grabbing one foot and then the other and forcing the baby to move one step after another. Then when the baby flat out sits down and cries at all this happening to them, the parents pick them up and try all over again while the baby's still crying. That would be a good recipe for walking refusal. So what's a typical history? Often there's been some early intervention of some kind or another that delayed an easy start. And all too often, there's a history of a well-meaning nurse or lactation consultant shoving the baby onto the breast, trying to get that baby started. And it could have happened just once or multiple times, but if it results in the baby being upset and the mother being upset, it creates negative feedback and frustration at the breast. Repeated attempts of trying to push the baby onto the breast instead of this calming way of doing it, those repeated attempts, whether in the hospital or by the parent herself, will reinforce these negative experiences. So sometimes at home, mom may think that she's supposed to be pushing the baby to the breast and trying to get the baby on. And after repeated attempts of trying at the breast, she starts feeling guilty that the baby's so upset. And so she feels guilty about giving up and offering the bottle. But what she's actually doing is actually calming her baby. And so it's appropriate that she does that instead of stressing her baby out. But what's happening is that when she has these repeated experiences are teaching both the mother and the baby that breastfeeding doesn't work. And it's also teaching them that they're both more relaxed when they go to the bottle. So when we observe mom and baby trying to start calmly at the breast, skin on skin, not in a breastfeeding position, what happens with these distressed babies? very often, if you put the baby on the chest in a non-breastfeeding position, the baby might be calm and in that upright position, and even start searching for the breast. But then at one stage or another, the negative memory clicks in, and the baby becomes frantic and more distressed, making getting or staying on the breast impossible. So some babies, they might start and towards the breast, and when they get near the nipple, start freaking out. Others might even try to get onto the nipple, like the baby in the video that we saw, and then get too disorganized to get on. But one way or another, they finally just are too upset to be able to continue, and that's what people call breast refusal or breast distress. So what's going on? This is classical Pavlovian conditioning. Both the mother and the baby have come to associate the breast with being distressed. Both now expect it not to work, and that distress of expecting it not to work interferes with either of them being able in a state conducive to learning how to breastfeed. What we need to do is reboot the baby. We want to start over. We need to stop all this negative reinforcement and start building positive associations. So what does that mean? It means taking time off from all attempts to breastfeed, so the baby can forget that all this misery. And fortunately, this doesn't take very long, especially if a baby's only a few days or a week old. Babies have very short memories, so you can reboot quickly. So for a while, we'll need to feed the baby some alternative method, which clearly the parents have already been doing if this baby hasn't been going to breast. And at the same time, we help the mother express milk to maintain her milk production or increase it if it's been faltering, as she's been coping with all this distress. So during this time off from trying, we need to build positive associations. That means lots of skin-on-skin time after the alternative feed, when the baby is relaxed and calm, satiated, and asleep. So they get subliminal learning. And so we're not giving skin-on-skin when the baby's hungry, which will only provoke distressing searching for the breast. So when can moms start letting the baby go to breast? It usually works best if it's not planned, if it's impulsive. It means that the mother is intuitively responding to something subtle in her baby's behavior, just makes her feel like it feels like the right thing to do. Typically, it's part way or most of the way through this baby's alternative feed, whether bottle or some other way. So relaxed and calm, but not yet so, quote, milk drunk that the baby isn't interested in nursing at all. So it's much easier if the baby's maybe 2/3 of the way through a regular feeding. But it's much more difficult if it's planned. So it's not like you say, let's wait for it to be 2/3 through. It has to be impulsive. So it's important to remember that these first attempts at feeding is play. We don't want to forget Pavlov's dog, so it's got to be about play. This needs to be fun and easy. So if the mom feels like she's trying or she's working at it, that's a good sign that she should just stop and calm the baby and maybe finish the feed the other way, because babies do not learn well under pressure. So after the baby has gone to the breastfeed easily once on that impulsive decision, the next few times are not likely to be all in a row. Just because the baby went to breast once, it doesn't mean the baby's going to be in the right state the next time. So even then, those times need to be impulsive. And so there'll maybe be some other alternative feeds in between. We don't want to put pressure on either the mother or the baby. So the next time might not even be the next day, or even 2 or 3 days in a row, or 2 or 3 days without even trying again. But there could be 3 times all in one day that the baby goes to breast. It's just responding to the impulsive instinct of the moment. So she only does it when it's easy, and so it's pretty random at first. So the key to all of this is that these experiences at the breast that the baby does have remain low stress, so that the baby begins to associate the breastfeeding with low or no stress. So that's why interrupting when it's not going well right away is just as important as not doing it in the first place. So just because a baby starts and it doesn't work, you stop. So, but as it starts to happen, that it gets easier, easier, that because the baby is now only associating the breast with comfort. So by the time the baby is no longer tense at the breast starts feeling safe now, because the mother will save the baby if there's any distress. Now that's when you're home free. And in fact, by that time, the tense baby can be calmed by going to the breast. So now we've reestablished positive associations with the breast. And now the mother can actually help and calm her baby. And we're home free.